Hello, we are David and Clare from Project Physio. Thank you so much for letting us guest present tonight at the first ever Royal Flying Doctors Fundraiser organised by your rural health groups.
Sorry we couldn't be there in person to present tonight. We're currently up in tropical North Queensland, but we thought we'd use this time to share a few stories of how we started our careers in physiotherapy and also share some tips and tricks for anyone else out there wanting to explore a career in rural health. We would like to take a moment to acknowledge the Gimoy, Walabara, Yidindi people who are the traditional custodians of the land on which we are presenting tonight. We would also like to pay our respects to their elders, past and present, and extend that respect to other Aboriginal and Torres Strait Islander peoples who may be present.
What started out as an idea to combine work with travel in Australia has since evolved into so much more for us. We created Project Physio in 2020 with the idea of bringing mobile physiotherapy services to communities with limited access to allied healthcare.
We are travelling around Australia in our self-converted bus, and over the last 2 years we've worked in a number of different states and territories, as well as across a range of clinical settings.
Although it doesn't really feel like that long ago that we're enjoying our uni events like you guys tonight, excited and maybe a little bit nervous about where our qualification will take us once we are graduated. So if you don't have it all planned out yet, your new grad year, your next 5 years of work, don't worry, we didn't either. Just so you know, your skills will be valued and required all over Australia.
So we thought we'd delve into some highlights from our work over the last 2 years. One of our earliest stints involved working in rural South Australia on the beautiful Yorke Peninsula, situated about 3 hours west of Adelaide. Here, our work was split across 4 main fields, based on the needs of the communities we were servicing. We worked in residential aged care, private clinic, home care packages, and community-based chronic disease management. We were fortunate enough to help out across a number of different residential aged care facilities across the Yorke Peninsula. We helped out with conducting resident mobility assessments, did falls prevention, manual handling for staff, as well as pain assessments and pain management for residents. Next door to one of these aged care facilities, we actually set up our own pop-up clinic in the local medical centre. So this allowed us to have an office space as well as open up to private clients in the community in need of physio. We also serviced home care packages in the community. So this is run under My Aged Care, and we were able to visit clients in their home as well as in the community, conducting rehab and reconditioning, as well as providing tailored exercise programs and recommendations for equipment. We were also lucky enough to collaborate with a government-funded organisation called Sonder, offering physiotherapy to individuals living in country South Australia for management of chronic disease. Through this program, we were able to offer physiotherapy free of charge in the form of individual and group exercise, as well as educational content to promote self-management of their conditions. Now, you might be thinking that this sounds like a lot of work to do all at the same time, but we just want to highlight some examples of the breadth of our profession and the many different possibilities that exist, particularly in rural areas.
So another place of work we would like to highlight is Geraldton, WA, so a place a lot closer to home for you guys. Last November, we completed a part-time locum at the public hospital in outpatient day therapy unit. So the public hospital up in Geraldton was such a fun time for us. We were surrounded by a really great team of OTs, speeches, dietitians, allied health assistants. We got to work with probably one of our favourite populations in older adults and those with neurological conditions. And yeah, the team that we worked with, we also just formed really great relationships with, and we're able to probably see the best parts of Geraldton on the weekends, maybe some local spots as well. We also did a private practice contractor role. This was predominantly sports-based clinic with a really lovely gym area, rehab facility, hydro, NDIS, and some older adult balance classes as well. So the clinic also offered a remote outreach service. They completed FIFO and drive-in, drive-out as well. This included going out with the allied health team to these remote communities and delivering rural health. So that's something that we really wanted to experience, and so glad that we did.
A question we get asked a lot is how can we help once we leave an area? Sure, there are certain things that can be implemented, like telehealth, as well as education and empowerment of clients to take a bit more control of their own health. But travelling around the country and supporting communities for such short periods of time didn't really feel like it was going to make a real difference to the problems that we kept facing in these areas. Problems such as chronic understaffing, burnout of existing clinicians, and of course, treatments being delayed or patients not receiving the physio care that they need. From these experiences, we thought that a different approach was needed. So this is why over the last 12 months or so, we've been working on our own project called InReach Co. InReach Co is an online platform that aims to bridge the gap between allied health professionals looking for work and businesses or managers looking to fill roles in regional, rural and remote areas around Australia. So through this project, we really want to highlight some of the truly unique roles that are on offer in regional, rural and remote Australia. And we also want to showcase some of the beautiful locations and clinical experiences that you might gain by working in these areas.
Alright, here's some tips for new grads wanting to work in a rural area. Tip number 1. Don't be deterred by thinking rural jobs don't offer quality new grad programs. There are many roles on offer for new grads in rural areas that provide strong mentorship and professional development. You can upskill quite early in a rural setting due to the demand and the broad range of patients you could be seeing. Number 2, here's your opportunity to experience a broader clinical caseload. Rural jobs can open your career up to experiences you would have never thought possible.
Tip number 3, work-life balance. Less time in traffic means new places to explore and new experiences to have. We have been to some pretty incredible spots all over Australia on weekends as well as between jobs. I think the beauty of our profession is that it can be really flexible and you can cater your work to your ideal work-life balance. Tip number 4, your career really is an adventure. As we've highlighted, your work can take you literally anywhere around Australia. You'll have ample opportunities for career progression, to gain clinical experiences, and to explore some beautiful locations. Through this experience, we have come to adopt an almost generalist approach to rural physiotherapy practice, adapting our skill set and services depending on what is needed most in each community. We have worked in combinations of private practice, public hospital, community, rehab in the home, residential aged care, and remote outreach. We have worked together with existing rural practices, government organisations, and have liaised with a range of rural multidisciplinary services to combine skills and resources to best service each community. We have also initiated programs under Project Physio in instances where there may be no existing services available in that community. Thank you for watching. We hope you were able to take away a little bit of insight into the work that we do and also the possibilities that exist with our profession, particularly with rural practice.
Sorry again that we couldn't present in person, but if you do have any questions for us, feel free to shoot us a message through our socials. You can find us on Instagram at project.physio. And if you want to check out our latest project, InReach Co, you can find that on our website, www.inreachco.com.au, and also on our Instagram at inreach.co. So yeah, thanks again everyone for watching and enjoy the rest of your night.
Thank you.